morning, Baltimore. It's Dr. Jeff Kalkstein with Dr. Zadolf and Kalkstein Chiropractic Office, your Baltimore area chiropractor. I know you haven't seen me in a few weeks, but Evelyn came in, about just a little over a month ago, right?
Yes.
And why don't you tell the folks your story?
I had broken my foot last year, and so as I was able to get on my feet and move around, I didn't feel comfortable in my back. I was afraid that I had pulled myself totally out of line. And so I asked my physician for the name of a chiropractor, and she gave me this particular chiropractor. It was one of the best decisions that I have ever made. First of all, I love coming here because the atmosphere is incredible. Politeness, courtesy, you can tell people really care about you. I love my doctor. By the time I get ready to come, I'm happy to come. And then when I'm ready to leave, I'm happy to have been here. I feel so much better now. I walk better. He gets on me about doing my exercise, and I'm doing better now than I was. I go down the steps better, and I just feel better.
Yeah. That's pretty nice, thank you. So there's a couple takeaways on that one. She feels more confident, and she's in a position now where she can take control of her health again before the injury, and she can start exercising without hurting herself, okay? But even more importantly, what I just love what you said to me was the experience that you had here, right? That's exceptional, right? The results are exceptional, but just as important, I think, is the experience.
It's the customer service that I love. It's how you're treated from the moment you walk through the door until you're ready to leave. It's from the doctor, it's from all the interns and all the employees.
Yeah.
They're really special. And in times when customer service lacks a lot, it feels great to come here.
Yeah. So I think that's one of our goals, is for every patient to come in, have a great experience, and receive great clinical results. So we're sort of winding down right now. So we're sort of releasing her on her own to keep her exercise program in. And what we did was, in the beginning, we showed her, we did some, because she was in so much pain, we did some physical therapy. We put some ice and stim on your back, showed you some general stretching exercises.
Yes.
And probably the cornerstone of what we did was adjusting her back. I think that took a lot of the pressure off the nerves, the pain calmed down, and
the tingling stopped.
Yep, and the tingling is the nerve irritation. So all those things started to improve, okay?
Yes.
So I'll show you what I did. We adjusted both sides of her low back, and then I adjusted her hips by doing some gentle traction. So why don't you hop up here and lie on your left side down for me, Evelyn. So we saw her three times a week, then gradually to 2. And if I can get her to come once in a while, that would be great, right?
Yes.
So bring your hip over here for me and slide up a little bit on the table, okay? Now lift your head up for me. There you go. How'd you break your ankle?
Carrying something down the steps that was too heavy, and I missed 4 steps, and I landed on my foot.
And having that just threw your whole gait off, right?
Yes.
So let this loose for me. Let your shoulder loose. There we go. To the side for me. Very nice. So what the adjustment does, it restores motion to the joints that don't move right. And when the joints don't move right, they have a nerve that goes right to the joint. It's a sensory nerve. It's called the medial branch of the dorsal rami. I'm getting technical on you right now. But when you can unlock that joint, that sensory nerve that sends that signal to the brain that says, ouch, I don't like this, calms down. When that sensory nerve goes to the brain says, ouch, another signal from the brain down to the motor neurons, all the nerves that go to the muscles in the back get tight. So you get this cycle, I call it a cycle of pain and dysfunction. The joint doesn't move right, it's inflamed. The nerves are irritated, the muscles all get tight. And so we address each one of those physiological issues in the treatment, right? And a big one is the adjustment. The adjustment frees up the joint. So look down for me. There you go. Good job. Very good. Nice job. Okay. And the last thing I want to show you, go ahead, rest your head down there, is I want to show you how I loosen up the hips up a little bit. And I tell you, this is some of the ball players' favorite adjustment. So relax your shoulders. There we go. Now slide up a little bit more. And let it go. Let it loose. There you go. So this one moves nice. That one's still kind of stuck.
Yeah.
Yeah. So I know we're taking you a 360 around the room. So thank you, Evelyn. That's great.
Thank you.
So if you have any questions, give us a call. It's Dr. Jeff again with Drs. Adolf and Kalkstein. Thanks, Baltimore.